Well, welcome back. If you're just joining us, you're right on time and you're watching Engendered. And we've been joined with our guest, of course. Our guest is a nurse because we're going to be discussing health related matter. I'll take you through, of course, the topic of our discussion today. But first, every day in 2020, almost 800 women died for preventable causes related to pregnancy and childbirth. A maternal a maternal death occurred almost every 2 minutes in 2020 and between 2000 and 2020. Now let's move. According to the most recent data, approximately 800 women die every day from preventable causes related to pregnancy and childbirth. This is about one woman every 2 minutes. For every woman who dies between 20 and 30 will experience injuries, infections, or disabilities. Most of these deaths and injuries are entirely preventable. And we'll be discussing pregnancy care and wellness with, of course, Nnenna Godwin. Good evening. And thanks
Good
for joining
evening.
us.
Welcome to the show.
Thank you.
All
I'm
right,
happy to be here.
Thank you.
You're welcome.
All right,
Thank you.
you had, of course, the background. What is pregnancy care and well-being?
All right. Thank you once again for having me here today. Pregnancy care generally is termed antenatal care or prenatal care, care that a woman receives when pregnant, and is usually done in the antenatal clinic by the midwife or the general practitioner or a gynecologist or a hospital doctor. So, and the care she receives depends on her health condition, and it depends on the complication she may have had in the past or may be having while pregnant. And at the same time, it will generally be determined by her health condition. So for a woman that will have an uneventful pregnancy, may not even necessarily see the doctor during antenatal, like in our general hospitals now, where we have a whole lot of women that are coming for antenatal. We don't have the doctors that will go around seeing all of them. So most of the times they have their vitals checked in the clinic, and then if the vitals are okay in terms of their blood pressure and the pulse rate, the temperature is okay, the midwife palpates and then gives out the routine drugs that she'll be taking. If she's to go for scan, she's sent to go and run a scan. But if she senses anything odd, she will now invite the doctor to continue with the woman. So, and if for someone that have had cesarean section in the past, she is to be seeing the doctor anytime she's pregnant again. So those are special cases because of previous scar or previous cesarean section. But if there is no problem, she goes on to see the midwife or the nurse midwife in the hospital until the time of delivery.
Okay, now what are the essential tips to maintaining a healthy lifestyle during pregnancy?
Yeah, I will like to start from teaching the girl child, because for me, pregnancy has to start once you are a girl child. You are taught about pregnancy. Preparation for pregnancy start at that time, feeding them well, letting them know while in school you need to take good care of yourself, personal hygiene, feeding well, and dressing well at the same time. So by the time one gets married, you are now prepared. You are waiting for pregnancy, and when it comes, it's usually a thing of joy. Like in the antenatal clinic, we usually tell them pregnancy is a thing of joy, because it's not everybody that desire it that gets it immediately, but sometimes it just happens, and when it happens, it goes with a lot of joy. Even the mood swings sometimes may make you happy and sometimes angry, even when you don't have control over it. But even when you try not to, you just see yourself getting angry, upset over trivial issues, But for a girl child, she is taught while in secondary school about this having to maintain her femininity, eat well, not dwell on junks. These days children like junk food. Is not healthy for us. So if you are preparing for pregnancy, you need to eat well. You need to take your drugs. We advocate for 3 months folic acid, 0.4 microgram of folic acid, 3 months before you take in, and then afterwards it will help prepare you. And then exercise is not good to gather so much weight, because pregnancy comes with it increased weight gain, your breast, your body tissue, increase fluid, so you need to control your weight. If you are at the big side, you need to start trimming down so that the pregnancy weight will not multiply in you, becoming very difficult for you to move around, especially later on in the third trimester. So it's good to feed well, have a good rest, and then prepare yourself emotionally. Pregnancy and breastfeeding is a thing of the brain. And there are people that when they give birth and they are not happy, breast milk will not flow. But if every surrounding features around you is okay, you can manage your feelings, and then you're able to eat well, take a lot of fluid, breast milk will flow. And when breast milk flow, you are happy because the baby is dependent on you for satisfaction, and you are dependent on the baby for relief, because if the baby doesn't suck, the breast gets engorged, you will have pains, So it's both ways. It's not parasitic. I think it's commensalism, yes. So the baby depends on you as much as you depend on the baby for your relief. So it's two-way thing.
I see Pamela learning so well.
Yes, there's one she said pregnancy makes you happy.
Yes.
I've seen a situation where, okay, should I say a lady who is not married and is pregnant, will you say that
That's an exceptional case,
Okay, there's also a situation where we've seen ladies who are pregnant and they are wicked. Like, they just do extraordinary things. They show extra wickedness, and you saying pregnancy makes them happy. I'm just imagining a woman's face I saw recently, like, she was not happy and she was pregnant. You saying pregnancy makes you happy was, wow.
See, it does. It depends on the angle you look at it. For me, I'm looking at a married woman in a happy home. Though aside that, there are times mood swing, what we call hormonal changes, do make you, even when you don't want to feel sad or feel angry, it just makes you do that. And afterwards, you may return back to yourself and say, was I the one that did this? But ordinarily, is a thing of joy that you are having a life inside of you. You are going to bring forth something that you don't know how it happened, So that joy, I'm going to bring a replica, a substitute in case I'm no more, that joy. And, there are times when you are pregnant, things around you will just seem so ugly, so things are not moving well. But you see, when the baby comes, it's as if doors begin to blessings. I could remember my first child when I was to have her. When labor came, my husband was like, "This baby don't come now. There's nothing in this house," But you don't tell a baby like that. But honestly, when I delivered, things, began to happen. Good things we were expecting before that time started unfolding, started coming up. So it's just the mood swing that can make you feel that way. But ordinarily, in a very good setting, a married woman in a good home, and have been anticipating to have a baby, ordinarily should be happy.
Okay. Before I allow Victoria, I like the fact you said that it starts from the girl child, but in reality, parents shy away from talking about these things, talking about pregnancy with their girl child. They always find a way to shy away from it, if not for the education system. Even most times in the classroom, you see teachers. So once you get to that part where you have to start telling them those things, you see they cut it off, because I don't really always know the problem with people opening up to talk about it. It's just like you talking about sex. They see it as a very
odd thing.
Yes.
Yes, you are right. You are right. It's just that when you are talking about sex education or things like that, it should be age related.
Okay.
You don't start talking about those things earlier in secondary school. Maybe those in SS3 that will soon leave to enter university. The level of maturity will absorb it, and there is a way you will put it. It won't just be blank. It will be, you are a woman. Like I used to tell my children, your private part is private to you, and no other person should touch it because it's private. So you must keep it private. Nobody should touch it. And when somebody does, scream. So if those are those smaller ones, but my bigger daughter, at least she's able to differentiate, between wrong and right. And when somebody look at you with an eye that is not pleasing, so at that time I lay it blank to her. I don't even mince it. I don't try to cover, anything, because what you don't tell them, they will hear it outside and hear it in a negative way, and they try to duplicate whatever they hear. So it's better you tell them the way it is, and then tell them the other side of it, and then they get prepared, to have it. It starts with what you give them, because at that age we are the ones feeding them. So like in my house, there is no sugar. I don't buy sugar because I tell them you don't need to eat sugar. Other food we eat has some sugar. The body doesn't need it. That's why sometimes you should mix your sugary things, your sugary biscuit and the rest with bitter cola. It's time everybody come and eat bitter cola. Get used to bitter things, because the body likes bitter things more than sweet things. So you feed them well and tell them there are dangers with eating junk. A lot of our children, if you don't give them boba juice, all those things, they will not. But I have stopped giving them. And I told them the preservative in this juice can give you cancer. So in future, we will have more cancer patients because we are feeding these children with juice that anything canned has preservative. And we were not taking that thing while growing up. So why will we be giving them? So they now know there is no juice in the house. It's water and your food, and then biscuits or fruits. Aside that, I am not putting juice for you. So when they even see somebody in the school drinking juice, you're still drinking juice. My mommy say it can cause cancer. I don't know how the child will understand it, but I've been able to convince them, and they don't bother me about it. So we learn to give them the right food and then educate them. Even when you are not there, it's not good to dwell on junk. It should just be sparingly few times that you will eat junk, but good food is good for you. And then water, plain water, is much better than juice or any other drink, So prepare them, and then they grow up with it.
All right, let me take you now back. Meanwhile, based on what you said about eating bitter things, I don't think that can work for me. Maybe I need you in my life to do that. Because no matter how, I don't think I want to be eating.
You have to learn it.
Okay.
You have to learn. It's determination. Whatever you're determined to do, you will do it.
Okay, so earlier you made mention about an antenatal. I would like you to take us through antenatal, what it entails, like how is it important in the life of every pregnant woman. And secondly, you said something about folic acid. Okay, does it have to be like 4 months or months before you want to get pregnant, or you can start taking it even as a young single lady, or maybe should it also be applicable to a male? Okay, and I think I have another question, but let's answer these 2 questions first.
Okay, I'll start from where you ended to where you started from. Okay, I think for a lady or a married woman, it's always good to have it at least 3 months before the time to just augment what you are eating. We are supposed to be eating lots of vegetables and fruits, but when it is not always there, you supplement with ingesting folic acid to help prepare you, and then afterwards, as tiny as the folic acid is, can prevent you from having the child having what we call neural defect, a problem with his brain or the general formation of the brain. So is very minute but very important. The folic acid is as tiny as tinier than most tablets, you know. So it's always good to start it and then continue with it after pregnancy, after conception, because most people take pregnant care. You are not stopped from taking pregnant care because pregnant care has folic acid. But sometimes we are still told to still take extra dose of folic acid when taking the pregnant care, you know. But for males, I don't think they need it. You know, I think it's mainly better for the girl or the woman. Yes, the woman that wants to take in. You know, men eat much better than women.
Really?
Yes, sometimes we are too selective, you know, or even eating the right thing. A man can leave you and go to a stop-by restaurant, order food, put all the condiments, and you are still in the house trying to safeguard the little you have for him again and the children. Yes, it's happening. It's our society. But a woman cannot find it so easy to go to a restaurant, sit down, order everything, you know, and eat. You'll be remembering, your children, what would they eat? Will I be able to spend all this for one plate of food? I can use it and make 10, you know. So, but men don't think like that. So, to me, I feel they eat much better than we do. So, we need to supplement with the folic acid. There's the first question you asked. Yes, antenatal. Antenatal visits should not be less than 6 times. It's just that these days that we have a lot of patients in the hospital, in general hospitals, when you go, they will give you like 3 months to now come and register. Before you know it, but somehow, you still find out that you don't do antenatal, you don't go for antenatal for less than 6 weeks. There's what we call Safe Motherhood Initiative. It's a UN program that was launched around 1978, and it seeks to help women or prevent against sepsis, maternal sepsis, obstetric bleeding, that's hemorrhage during pregnancy and after delivery, and also venous thromboembolism, and then severe hypertension. You know, there are women that once they take in, their BP begin to rise, what we call eclampsia, you know. So the essence of that initiative was to help women, because there is no woman that is supposed to die while pregnant. You have the right to carry your pregnancy to term and deliver healthy and strong baby. You know, so that is what the initiative is talking about. So antenatal should not be less than 6 visits. And then during the visit, they check you, the well-being of the baby and yourself. They teach you personal hygiene, because there are women that when they are pregnant, they become so lazy, fatigue, not intentional, but the signs of pregnancy sometimes do weigh them down. So they are not able to meet up with their personal care, but we are encouraging them to always try to do that. Clean up themselves, just shower as much as possible, at least twice a day, change your undies. There are some women that when they are pregnant, they can't wear tight clothing. Like myself, the last pregnancy, I couldn't wear anything tight, even undies. So I end up wearing the shimi that we have left behind, you know, just to have something under. And I can't sit and someone is sitting beside me so snuggly, you know. I don't want that. I just wanted to be free. So all my clothes were oversized and I was okay with it. But somebody looking at me may not like it. So you go for what suits you. You know, whatever that makes you comfortable, wear it. We're not allowed to wear high heel. Because there is a shift with your gait, with your mobility when you are pregnant, and the hormone relaxing around your muzzle. So it won't allow you to control your gait. That's why most times women later on in pregnancy tend to fall so easily. So you are encouraged to wear a flat shoe that has lines so that it doesn't slip you off. Something that has not peeled under it, something that still has, you know, some lines under it, so that it can hold you. So, and then high heel, And it's not allowed. When you're pregnant, you leave the shakara behind a little there where
But
you.
some people do shakara even when they are pregnant. Is it an exception? They even dance, like they kind of
Yes,
behave normal.
the likes of those celebrities.
Nnenna and the rest. Yeah.
Yeah, those ones is something they have been doing so much before they took in, but they don't dance as much as when they are not pregnant. It's still controlled, but that's an exceptional case. There are people that swim so well, but when they are pregnant, they still swim, but not as much as when they were not pregnant. So if your pregnancy allows you to do that, why not? There are people that it will not allow them to do that, but if yours allow you to, why not? Go ahead and do what suits you, what interests you, and then journey of 9 months is not just a day, but all those activities keep you going on. Before you know it, it's over, and somebody's saying, when did you take in? You already delivered, without knowing the stress you've gone through. They say it's who has the head knows how it, or who wears the shoe knows where it pinches, So it's you that knows how it's been all along. But somebody, madam, no, you're already put to bed, So it's always good to abide by those things. Your dressing, wear what suits you, your shoe, your clothing. And then there are people that are cosmetics when they are pregnant. The smell of what they have been using becomes toxic to them. They would not want to use their powder anymore. They would not want to rub their cream. They would not want to lipstick, everything. It happens to me. Like those that used to perceive a lot, any small odor, they have perceived it. In pregnancy, it exaggerates. Becomes, yes. Anything you do, like those that used to have premenstrual syndrome, very painful premenstrual syndrome. Pregnancy exaggerates, symptoms exaggerate. So, something like that, though it's not everybody, but I have seen it in most people. So like me, any small odor I perceive. So when I'm pregnant, I don't like my powder anymore. I don't like my cream. I'll go to the shop to smell the ones that suit me.
But were you dark? Did you become darker?
Yes. I used to become so. It's the hormonal changes. There are people that don't get dark. But myself, when I'm pregnant, if you're seeing me for the first time now, you will be like, Madam, are you a fair person? I used to be very dark. I would have come with one of my pictures. I used to be very dark when I'm pregnant, and I don't like using what I used to use. Those powders, I go and smell the one that suits me, the powder. I may or may not rub cream. I don't send. There are times I even used to barb my hair because the heat becomes so much. I won't be able to control it. Yes.
Go through a lot.
Yes. I barbed the hair and I was happy barbing it. Late in the night, I just...
Freedom.
Freedom at last.
Let's talk, still talking the antenatal you spoke about. There are people, women who give birth to 1, 2, maybe the third child, they'll be like, they already know what to do and they no longer have any reason to go for this antenatal. What is your view on that?
Wow, it's actually not the right thing to do. It's not the right thing to do because every pregnancy comes with its unique differences. It's not what you see in this pregnancy that you will see in the next pregnancy. Sometimes if you are carrying a baby girl, it may come with some signs. When you are carrying a baby boy, maybe next pregnancy, it may not be the same thing. You will now assume, maybe it's another sex. But unfortunately, when you deliver, you find out it's the same sex. But what you had, the symptoms you had were different from each other. So it's always good when you are pregnant. In fact, we are advised once you miss your menses, once you miss your period, you go for a scan. But, because of economic situation, so most people don't. And then some people at the same time, they stay till when they are 4 or 5 months. Let me be sure it's pregnancy before they go. Some don't even go at all. They feel they already know what they are. These nurses, is it not the same thing? Some of them will even come and be gisting. They will not even listen to the health personnel that is giving health talk to learn. They say, is it not what we've been hearing? At the end of the day, they miss vital information that will help them because we've seen cases where a woman is entering the labor room without anything. and he's telling you, my husband is bringing it. And before you know it, this woman will put to bed. You see the head coming out and there is nothing on ground. You will end up using another person's commodities to help deliver this woman. And up till the time this next person is to deliver, her things have not still come. It may be that she didn't even buy. Or one thing or the other must have held the person bringing it back, So this person you have borrowed from to deliver her, you have nothing to deliver the real owner of those things. So it's always good to go for your antenatal checks as at when due, so that you will be well informed. By the time you go, you will remember some things that you may have forgotten. When you come back, you're able to arrange your things, arrange your baby clothes and the delivery items you're supposed to go to the hospital with. And we usually tell them, when you are due, put your hospital card in the same bag. Because when labor pain comes, sometimes they get disorganized. You may forget the real thing, but once it comes and you leave that bag, you know everything you need to deliver that baby is in that bag, And when you get there, even if you can't unzip the bag, somebody can help you and get it, and then you receive care even before relation comes. So it's always good to attend your antenatal. Don't say, what are we going to hear? Me, I be old school. And what am I going to hear? What is the new thing? These nurses are going. There are new things. Things are changing. So we need to update ourselves with, every pregnancy.
Okay. I'd like to ask, initially when we were talking about hormones, I was going to ask, what's the rationale behind a woman smelling food from a distance, and that's what she wants to eat? Yeah. If you can explain that. And also, I also want to ask about miscarriages. How does it happen? What happened? What goes wrong for a woman to miscarry?
Okay, for a woman perceiving the smell of another woman's food and wants to go there, is it no longer?
Well, almost every pregnant woman do it.
Yes, almost every pregnant woman does that. Yeah. But there are still few cases where a woman will finish cooking her own food. She will not like to eat it. She will not prefer a neighbor's own or even a child's food, a neighbor's child food.
But did you do anything like that?
No, I didn't. But the only thing I know I did was I didn't like the smell of some food. But I was eating. I'm the type that eats. In fact, if I'm pregnant, you may not even know for the next 3 months. If not that the tummy gets bigger, I eat normally and I go about my. In fact, the last pregnancy I was at work when the labor started.
You're a strong woman.
And I didn't, of course. So when I see those ones that when they are pregnant, they can't do anything, they're just lying there, I'll be like, is it not the same pregnancy that we carried?
People vary.
People. So I respect them for that. I don't, discriminate them against that about that. But it's always good to help yourself. Hormonal changes, is something you can't control, but it depends. It still depends on how you have been living. You can still help yourself somehow, because going to a neighbor's food every now and then, for how long? Though most times it's usually the first 3 months. The first trimester is usually weird, but from the first, as you're entering the second trimester, you start getting used to things and then begin to do things much better and then start adjusting to the hormonal change. The first 3 months is usually the problem. But once you enter the second trimester, you start feeling baby movement, what we call quickening. You begin to adjust. Those swings will begin to relieve. You get relieved of them. So the other question.
Miscarriage.
Okay, miscarriage. This miscarriage comes in different ways. If there is hormonal imbalance, you will likely have miscarriage. There was one of my pregnancies I had what we call blighted ovum. I had the signs of pregnancy, but when I went for scan, they said they can't see the pose, the fetal pose. when they run a scan the first 3 months, say his fetal pulse, you will see. So they said they can't see it, but I was still feeling like a pregnant person. So after they said, okay, we'll give you another 2 weeks, come back for another scan. I went back and they still said the same thing. They said it's blighted ovum. I then started seeing spotting. I started spotting, and after a while, the spotting changed color to dark. And they now said, we have to evacuate you, madam. This pregnancy is not going to thrive. So they had to do evacuation, evacuated, and I then started preparing for another pregnancy. So miscarriage, sometimes it may not be as a result of a strenuous or a trauma or a heat. Sometimes some people may fall and may not miscarry. Sometimes they will fall and miscarry. There are people that they may not know they are pregnant and they will take some drugs that they are not supposed to take. They will miscarry. Some people still don't. The way God does his things, there are times in our ignorance, he will just overlook. But there are people that will not take wrong drug and still miscarry. So it varies with individuals, but mainly if there is hormonal imbalance, that's the estrogen and the progesterone that is supposed to help prepare the uterus and help implantation of the baby. If it's not adequate, one may likely miscarry. Sometimes stress, if you are not resting as at when due, and tension is so much around you, you may miscarry, or you take the wrong drug, you may miscarry. At the same time, maybe chromosomal aberration, maybe what we call, if the child should have a defect, inborn, congenital abnormality, it may lead to miscarriage. And that one, we term it to be a good one, because we don't want to give birth to a child that will give you problem for the rest of his life, So most times, those ones happen later on, maybe 2nd or 3rd trimester, when you're about to deliver. You will just realize baby has stopped moving. Fetal death, intrauterine fetal death. So by the time that baby is born, we just induce the woman will deliver. So by the time the baby is born, he would detect a defect. So in that case, we will thank God, though somebody is crying, or it's better to cry then and then have another one that will not give you problem, So miscarriage can just happen like that, looking at these factors that we have enumerated.
Let's just, on a lighter mood, how can a partner, how can a family support pregnant women in their wellness journey?
Yeah, pregnancy is not, I am the one carrying, but I'm not the only one at stake. Without the man, I won't be pregnant. And without the family, there won't be that man. So that's the link. So everybody has a role to play. The family has a role in supporting the woman, giving her emotional counseling, making her happy. Don't overlabor her with pains or stress from your own angle. Relieve her of some of the house chores, so that she can have time to rest if it's someone that is not going to work. But even those that are going to work in the office, most colleagues are so nice that some work they'll say, madam, don't worry, wherever, even when you're entering a vehicle, when some people, once you're pregnant, they see you, they won't stop to help you. If not that things have changed these days, that people are now so afraid, to help. When you are pregnant, you are anywhere, somebody wants to help you. I can remember the few times I entered public transport. Immediately I entered, it was filled. Somebody stood up immediately, madam, come and sit. So anytime,
but not like that again. People will not stand up.
Things are changed. Even in the bank, when you go to, you're given preferential treatment. When you go to ATM machines, the person next to cash, you just, madam, please just come and do your transaction, But these days, people are so angry, irritable, and
you wouldn't blame them.
And then on the part of the husband, he has so much to play. You need to give the woman listening ear. There are times we nag unnecessarily. It's maybe the mood swing, you know. So give it to her. Don't get angry yourself. You are not the one pregnant. The person is pregnant is angry. You that is not pregnant should try and calm her down, calm the situation. Whatever is making her angry, handle it. Take care of her, take her out, get her some things now. Clothing will change, bra will change, everything will change. So support her in providing those things as much as you can. And if you don't have, still talk with her. Communication is the key. You know, let her understand we are all human, and then bring her close. Don't leave her and stay away with friends all day, all through the night, and leaving her alone. She needs you. She needs your companionship. She needs you to talk with her. She needs you to even help her in the kitchen. Nothing is wrong with a man being with the husband in the kitchen to cook. Help do this and that, you know. It gives her that sense of concern, that sense of love, that I'm valued, and everybody is working together to have this baby. Because this baby coming is not the woman's own alone.
Exactly.
You know, it's everybody's own. So everybody will just have to work hand to hand then to make her have an uneventful pregnancy, delivery, and then postnatal care.
You know, I was going to ask you how possible it is for one with fibroid to have what kind of care should a woman with fibroid intention to perhaps get pregnant, what kind of care such person should get?
Is it for someone that has fibroid and is pregnant, or someone that has fibroid and intends to be pregnant?
Okay, maybe both. So quickly, maybe under 2 minutes.
Okay, okay. For someone that is lucky to be pregnant with fibroid, so fibroid is coexisting with the baby, you know, is a good one. You know, because there is a site the pregnancy, the fibroid will be that will not even allow conception in the first place. If it's at the site of implantation, definitely pregnancy will not occur, because the fibroid will occupy the place where the implantation is supposed to take place, you know. So for those that are having the fibroid coexisting with the baby, most times they eat more, because as you are eating, fibroid is taking its own. The baby is struggling with the fibroid, competing for nutrients through the placenta. So sometimes they used to bleed, but after a while it stabilizes, and most times if it grows to delivery, we always advise them to go for elective CS. So most cases, as they are extracting the baby, they are removing the fibroid at the same time. But if it's the type that it didn't grow with the baby, it was not growing with the baby, it can still be there. I have an auntie that was having fibroid and have had 4 children, and the fibroid is still there. So in her own case, it's like the fibroid was not growing, rather the presence of the baby suppresses the growth of the fibroid. So that one is a miraculous case, you know. But for those that are having fibroid and they want to get pregnant, if the size of the fibroid is much from the scan results, and the situation of the fibroid is where implantation is supposed to occur, we advise you go for myomectomy. That's removal of the surgical operation to remove the fibroid, and then you take in afterwards. You can, 3 months after that surgery, you can take in, you know, because I have a sister friend that had the myomectomy done and she didn't take in. After a year, she couldn't take in. It reoccurred. It grew again. You know, this fibroid is like, since baby don't want to grow here, let me stay now. But it doesn't know that it's not wanted. You know, so it's always advisable to do myomectomy, remove the fibroid, and then prepare for pregnancy.
Thank you so much. It's been a wonderful
Educative
section. Pamela, I'm sure you learned.
I did. I did.
Maybe you should start preparing to get pregnant already.
So when you are preparing, let me know.
No problem.
Thank you so much,
for
for
being on the
coming.
show.
Thank you. Really do appreciate. Well, that's because time is fast spent and we have to go. And because they're already telling us in the MCR too. Go. Thank you so much, viewers, for joining us on this episode, and really would want to do this again. That's what I was telling our guests. Thank you, so that whenever we call on her again,
She will come.
she will come. So it's been a wonderful session on Engendered, and until next time, I am Victoria Agbi.
I am Pamela Ajaero. Thanks for joining us. Bye for now.
Bye.
Thank you.